ready? So my name is Jessica Hagan. I'm a student nurse at Minot State. I am getting my bachelor's in nursing. I graduated from Devils Lake High School in 2015. And then I have my teacher with me today. Her name is Ashley DeMakis. She has her master's in nursing, and she's also a certified aromatherapist. So today I will be going over dual credit classes, preparing for a nursing program, the foundation for a Bachelor's of Science in Nursing, opportunities for BSN graduate, and some frequently asked questions. So dual credits are really important if you have to take them in high school, if you have the opportunity to do so, because it will help lighten your load once you guys are in college. I'll discuss when you can take these dual credits in a later slide, and then how they fit into the curriculum. So some dual credits that you can take in high school are public speaking, your English classes, which are called English 110 and 120, your history class, your psychology, sociology. You can take a CNA class through Lake Region State. I don't know if they offer it here at the high school to take, well, like you're in school, but you can do it online through Lake Region. And then a medical terminology class. So this will help you understand what certain words mean, what certain roots of the words mean. I know a lot of medical term is Latin, correct? So to prepare for your program, it is really, really important to tour the campuses that you're interested in going to, because you will get to see what your building looks like, how far apart all of your prerequisite classrooms are from each other. I know a lot of colleges are very spread out, and so you have to walk from one building all the way to the other building, back to this end of campus, and so on. At Minot, our campuses are in like kind of a box, so they're all really close to each other. And then our nursing department is on one floor in a building, so we don't have to travel anywhere during the day for classes. The next important thing to do when you're touring a campus is to meet with an advisor. They will help you set up your schedule for each semester. They will tell you when you need to take certain classes. They will help you understand what the classes are and the classes that you're taking. And they will also give you more information on what the program has to offer while you are attending the college. I strongly recommend to work in the medical field, because this helps you get an understanding of what you're going into. You can work in the medical field as a CNA at a nursing home, at a basic care center, at a hospital. You can work as a home health assistant. So this is providing in-home hospice care or palliative care to a patient who is expected to die within 6 months, or they just need extra help caring for themselves, like taking a shower, feeding themselves, going to bed, things like that. You can work as a medication assistant. They work in basic care centers and nursing homes, passing medications to patients throughout the day, so they can give them insulin shots, you can give them their heart medications during the day, you can give them their Tylenol, and so on. And then you can also work as an EMT, which stands for Emergency Medical Technician. You work on an ambulance, or you can work in an ER as an EMT. That class is also about a 6 to 9 months class. You get a lot of experience working in the medical field. It helps you understand what nursing is all about, and then what kind of specialties there are in the medical field. I also recommend taking a health careers class. It will let you see other career paths there are in the medical field, such as a veterinarian technician, like I said, a CNA. You can learn about doctors, you can learn about surgeons, and then you will also be able to job shadow certain areas that are interesting to you. So this is an example of what my schedule looks like for college to get my bachelor's degree. This is a total of 124 credits. I looked last night and I have taken 156 credits, so I am far past the credits that I needed to take, but I didn't have all my nursing credits done, or I'm in the process of it. So that's why I am still in school and I don't have my bachelor's degree yet. So to apply for a nursing program at Minot State, the starred credits or the starred classes here with one asterisk next to them, you need to have those completed or in progress when you applied to the nursing program. The dual credits that I talked about earlier, here are your English classes in your first semester and then your second or third semester of college. Those are very helpful if you take them in high school because you lighten your credit load. You don't have to pay as much for the class. You don't have to buy your books in high school. Your books are provided to you versus you're going to spend $400 on an English book that you're going to use for a year, and then to try and sell it back, they give you like $50 for it. So you have your introduction to your psych and your soc here. So this will, if you take those, you get rid of 6 credits, so you're down from 17 credits to 11 credits your second semester of college. Your history class, you take that during your third semester in the nursing program. If you were to take it in high school, you subtract 3 credits from the 16, so you're down to 13 credits and you're able to focus more on the classes that are important during the program to achieve your degree. You can take your humanities and your philosophy classes here. You can substitute those out and take them here for your spring semester if you already have your psych and social degree done. That way, like I said earlier, you have 2 less classes to worry about and you're taking 10 credits this semester instead of taking 16. Because you can get really busy doing clinical paperwork, going to hospitals, preparing for tests, traveling, and if you work in college like a lot of us do, it really makes it hard to find time to do your homework. So at Minot State, we complete over 1,000 clinical hours in the hospital doing hands-on patient contact. That does not include any of our simulation hours with robots and practicing like moving patients across beds. Like we practice certain skills on each other that aren't going to harm them or cause them an infection. So here, I will talk about the program. So your spring semester, you can apply in the fall here. You get accepted, and then you take your your fundamentals and your health assessment class. Also this semester, you can take your pharmacology and your pathophysiology, but like I did, I wanted to lighten my load for the first semester because I had no idea what I was getting into. I didn't know how many hours I needed to study every day. So I took my pharm and my path during the summer, online at my own pace, and I was able to understand what I was learning. If I had questions, I just reached out to my teacher. So in your assessment and your foundations class, you learn how to do a head-to-toe assessment on a patient. You learn about basic disease processes. You learn how to pass medications to clients, why it is important to ask them their name and their date of birth before you give a medication. Otherwise, you could be giving Sally's medication over here to John, and then John ends up very ill or his blood pressure drops because you gave him a certain medication. Your second semester, you have your abnormal psychology. Again, that can be another class that can be taken in the summertime, or if you have your English 120 done here, you can bring that down here. And then your second semester, all you have to do is focus on your nursing courses again. You have your Adult Health 1 and 2. Your Adult Health 1 is 8 weeks, and your Adult Health 2 is the last 8 weeks. There you focus on the medical floor and the surgical floor. So you learn about all the disease processes, different types of cancers, medications used during cancer treatments. And then you have your theory and research class. That is where you pick something that you want to focus on and study for the next 16 weeks. You're put into groups for that. My group, we chose to do infections based off of your hospital scrubs. So for me, I wear these scrubs at my house, and then I go to clinical. So whatever is on these scrubs from like germs in my house, I'm bringing to the clinical site, and I'm passing those around. I'm getting germs from patients there, and those are going onto my scrubs, and I'm bringing those home with me. So for my theory class, we focused on how you should wash your scrubs to prevent them from keeping more germs on them, why hospitals should provide scrubs in there for people to wear. And then your third semester, here's your history requirement. You can take that as a 10th, 11th, or 12th grader here. I think I took it when I was a junior. So there again, I was able to just focus on all of my nursing classes. So you have your child health nursing, which is your pediatric. So you go to Head Start, you give vaccines at the child health clinic, you do your rotation on the pediatric floor. Then you have your mental health nursing. So that focuses on like psych patients and mental health diseases, different types of medications you can give to psych patients, and then different types of like therapies that they can go through. And then your women's health and maternal newborn nursing. That is where you learn about different stages of labors, when and how to calculate due dates. So if someone is pregnant in February, you follow this little algorithm and you'll find out when their due date is. In that semester, you can also watch like live births, C-sections, what else? Oh, you go to the NICU in your maternal health child nursing classes as well. So that's really fun. I really enjoyed the babies. Your fourth semester, you have your public health nursing, where you go to rural communities and you can do flu clinics in a small town. So in Minot, I traveled 45 miles northwest to a town called Mohall, and I performed foot cares with my nurse during the day. I was not excited when I found out I was going to be doing foot cares, but at the end of the clinical, it was very, very rewarding because I was able to care for older patients' feet, shave the dead skin off, cut their toenails, wash them, check them to make sure they're not developing any sores, and then they thanked us because once you get older, it's a lot harder to bend down to even just tie your shoes or put socks on. So it's kind of a longer process that they're not able to handle anymore. Then you have your adult health nursing. That is where you do your ICU, your PCU, which is a step down from the ICU unit. And then you also do your ER rotation. And then your humanities and your philosophy classes, those you could also substitute for one of these dual credit classes that you take, or again, do it over the summertime. I know I always like to stay busy, so I did a lot of these extra credit classes over the summer, just so I can stay in school mode and continue working through. And then your last semester, which we call S5, you have your nursing review class, which is where you prepare to take your NCLEX, which is a big test that you take for your boards to become a licensed registered nurse. You have your trends and issues and your leadership and management class. So here you learn about how to be a leader in the workforce, all the different ethical issues that can happen, different steps that you can go through if you have to go to court for something based for like a patient. And then you also learn about different systems in the hospital to improve patient care. So one thing that we focused a lot on was quality insurance. So if a patient comes in and let's say, for example, they're septic, that's where you have an infection in your blood. How can we get these test runs faster so we're able to treat them and they have a better chance of living? Because I learned when I attended my quality insurance meeting that for every hour passes by and you're septic, you have an 8% chance increase of dying. So let's say you're septic for 2 hours, you have a 16% chance of not living from that. And then your nursing practicum course, sorry, I should have said at the beginning, your 5th semester is 16 weeks. The first 6 weeks are your 3 classes that I listed off, and then the last 10 weeks are your practicum. So you complete 270 clinical hours in the hospital, caring for patients, doing your journals, and so forth. So that is what I'm currently in right now. And then certain skills you will learn during the program. I mentioned a few, such as how a baby's born, how you give medications. You'll learn how to set up a sterile field, insert IVs, collect body specimens for testing. You'll learn how to do CPR, do post-mortem care on a person that has passed away, and then you'll learn about an insertion of an NG tube, which I really enjoyed learning. It was like one of the first skills that I learned. So that's where you stick a tube up somebody's nose and then down through their throat into their stomach to pump the fluids out. A lot of times those are inserted for patients that have like bowel obstructions, so they're not able to pass those fluids through their bowels and get rid of them the normal way. So a 2-year degree versus a 4-year degree. Are you guys 9th or 10th graders? 9th? Okay, so my example that I was given to the last class, so say you're going for your 2-year nursing degree and you're starting out as a freshman and you do your 2 years, so you have your 9th and 10th grade year, and then they're just going to send you off to college after you're done with your 10th grade year. So that can be really hard because you haven't grown as an adult. You don't really know how the new world works or how the world works yet as a new adult, and it's kind of hard to like learn how to care for yourself and care for people at the same time. So for me, I graduated high school when I was 18. If I would have went out into the workforce when I was 20, I would have been very, very like nervous and not really knowing how to care for those patients because I was still learning how to care for myself at that age. So with a 4-year education, while you're building your foundation courses here, you're also growing as an adult. You're learning skills that you need to learn to get through life. So another reason that I pursued a bachelor's degree over an associate's was because I am taking 5 semesters of nursing classes, period. For a bachelor's degree, only 5. If I were to get an associate's degree, I would also be completing 5 semesters, but then I would have to go back and complete 4 more semesters to get a bachelor's. So I'm completing 9 semesters for a bachelor's versus 5. So getting into a program can be really, really difficult, but at Minot we offer a guaranteed admissions program that you can apply for. So to do this, you must achieve a 24 or higher on your ACT score, or if you got like an 18 or a 19, you can have a cumulative GPA in high school of a 3.5. You have to graduate from a North Dakota high school, which all of you guys are in the process of doing right now. Your first semester of school, you apply or enroll in an FYE program or class, which is called freshman or first year experience. Only freshmen have to take it. Excuse me. Here you learn about different clubs on campus. Your FYE class is based off of other students who have declared nursing as their major. So you get to meet students who are also interested in nursing. You get to participate in different activities around campus. You help other students out, and it's a really good way to get to know people. And then you also have to declare nursing as your major when you start college. So when you apply for colleges, you write your name, address, and then you say, my major is nursing. And then the last requirement for a guaranteed admission is you must go to Minot State right out of high school, because going there right away will get you into these classes and you'll get to the program quicker. Another thing I forgot to mention is, let's say you have all these general dual credit classes done, you can apply for the nursing program this spring to start in the fall. But if you want to follow this layout here, you would apply in the fall to get in the spring semester. So opportunities for a BSN graduate. All the bachelor schools across the state of North Dakota have a club called Nursing Students Association, which is called NSA. NSA is a club for pre-nursing and nursing students. So think of it as student council, but it's all about nursing. So you volunteer, you give back to the school, you host blood pressure events, you take blood pressures out in the community. You can have different fundraisers. So I was involved in my local chapter. I was part of the Breakthrough to Nursing from 2018 to 2019, and then that same year I was the state director of social media, and then I just finished in January my term as the state president of the Nursing Student Association. So for career advancements, a BSN has more opportunities for advancements over an associate's because they are able to work in a more technical, specialized area due to the amount of training that they have and the clinical sites that they get to go to. Additionally, a BSN may continue on to graduate school after you graduate with your BSN. So you can get your master's in nursing, or you can go on to get your nurse practitioner. And there are several programs across the state and the United States that are designed for associate degree nurses to earn a bachelor's, but oftentimes this is done while you are already working as a nurse, and it's online. So you have to find time to balance your 40 hours that you work every week plus going back to school. So jobs as a nurse, what kind of nursing jobs do you guys think are out there besides working in a hospital? So a hospital nurse, you can work in an intensive care unit, pediatrics, emergency room, psychiatric, mental health, in a rehab center where people who have strokes, they'll go and stay there for a month to get stronger, learn how to care for themselves again. You can work on a surgical floor, a medical floor, a neuro floor. You can also work in an office or a clinic setting. Typically this is where like the LPNs like to work, but if you have a family and you have kids and you want a more set in stone schedule, you can work in a clinic from 8 to 5, Monday through Friday, no weekends or holidays. You can work as an occupational nurse or in an industrial. So an occupational nurse works with a doctor doing screenings on like police officers. So every year a police officer has to get a physical test done to make sure their heart's working properly, they can hear and they can see. So a nurse does a lot of those tests. You can work in a home health nursing, so again, caring for hospice patients. You can work as a travel nurse or for an insurance company. And then another thing you can work in is IT nursing. So Ashley used to work in that. It's information technology. So she just reviews charts of nurses in the hospital and is like, hey, you forgot to chart this on this patient, can you go back and chart it? Or if you're new to that hospital, she will sit down and show you how to work that program. A bachelor's nurse can also work as a nursing supervisor or a manager. So a nursing supervisor oversees all of the nurses that are working during a specific time frame during the day, and if there's like a large trauma that comes in, that house supervisor can send down nurses to help in the ER. And I know many people now think like flight nursing is super cool, but to do this you need to have a bachelor's degree and work for at least 3 years as a full-time nurse in an intensive care unit. So clinical sites is another great opportunity for BSN. In Minot, we have more places for clinicals instead of a nursing home and a small hospital. We have a level 2 trauma center. We have medical, surgical, labor, delivery, cardiac, cath lab. This is where you go if you're having a major heart attack. They'll go in through your groin, inject some dye, and then they'll open up your vessels so your blood's able to pass through, and then your heart is beating regular again. I mentioned the ICU and the PCU. We have a mental health unit, pediatrics, multiple operating rooms that you can get in on different surgeries, home health clinical rotations, and then the rural clinical sites where you travel. So some frequently asked questions that I get is, when should I start looking for a job as a nurse? So I started looking in December, typically 6 months before you graduate with your bachelor's degree. I accepted a job in December. In the ICU at Sanford and Fargo, I'm starting out at about $28 an hour. And then how much do nurses make per year? The average salary in the state of North Dakota is about $68,000. Many places also offer sign-on bonuses ranging from $1,000 to $15,000. So why did you want to be a nurse? I'll let Ashley go first and tell you why she wanted to.
My mom and my 2 aunts and my sister are all nurses, so I kind of grew up in the area of nursing, and I always like helping people. I enjoyed working with children, so at one point in my nursing career I worked in pediatrics, which is working with kids. I also worked in same-day surgery and the interventional radiology, staff development, and then most recently clinical informatics. And then after being a nurse for 18 years, I decided to go back to school and get my master's, and now I teach at the university. So there's a multitude of different options that you can go to in the nursing field. And if you're not happy in one area, you can certainly go and look into a different area as well.
So for me, for nursing, I didn't really want to be a nurse right away. I was really afraid of people dying. I was scared of death. I took the health careers class here at the high school, and I was able to job shadow in Grand Forks for a couple weeks under UND residents and nurses. Sadly, this program is no longer offered, but this is where like I fell in love with nursing. So then I took a CNA class, and right before I never worked as a CNA, and then right before I was about to expire, I started working in a basic care unit here in town, and I just loved it. Went to college. First day of college, I said, nope, I want to go into cosmetology. I want to cut people's hair for the rest of my life. I took business management classes for like 2 days and decided this was not my thing. I'm going to be a nurse, and ever since then, I absolutely love it. I worked as a CNA on a surgical floor, medical floor, ortho floor, neuro, and then I worked in the ER for 2 years, and then I also work on the ambulance here in Devils Lake when I get a chance as an EMT. So I kind of found my little niche there. Another question is, what kind of hours do you work? So you can work 8, 10s, or 12-hour shifts. Some places you work every other weekend and every other holiday, and then other places you can work every 3rd weekend, so you have a weekend off, and then you work, and so on throughout the year, or you can work every 3rd holiday. My job that I accepted, I'm going to be working 3 12-hour shifts in a row, and then I work every 3rd weekend. What is the difference between an LPN and an RN? So an LPN is usually responsible for obtaining vital signs on a patient, performing procedures such as dressing changes, giving enemas, administering medications. They typically work under the supervision of an RN or a physician. Most of the times, if you're working under a physician as an LPN, you're working in a clinical setting. RNs, however, have direct responsibility for the patient. They work under the supervision of a physician and are involved with patient assessment, diagnosing, creating a care plan, carrying out the care plan, and evaluating how the care the physician and the nurse are providing and what the outcome of the patient is going to look like. So what if you are no longer happy as a nurse? I would say take a break from the medical field. Burnout can happen super easy, especially as a new grad, because you're so excited that you got your bachelor's degree and you just want to pick up all these open shifts and work all these extra hours and make a bunch of money. But that is how you overwork yourself, and you really regret going into your career choice after that. You can become a nursing educator to help students through nursing school. You go to clinical rotations with them, you teach them throughout college, but to be a nursing educator, you have to have a master's degree. Or you can also change your jobs or your career path, but I recommend keeping your license valid because you worked super hard to get it and it was very expensive. So when I'm done with school in May, I will take the NCLEX, which is a very big test and it's a lot of money, and that will certify me as a nurse to legally practice in the state. To keep your license active, you have to take 12 continuing credit hours every 2 years. And then how much does a bachelor's degree cost? So at Minot State, each semester averaged, when I was in the program, about $3,000, but they have over 30 scholarships that you can apply for as a student to help pay for your education. So out of pocket, I paid under $1,000 about each semester. So do you guys have any questions for me? No? Okay. So how many of you know what this device is? Or have seen this before? Yes?
It's a machine that does compressions, right?
Yep. So this is called the Lucas. These are very expensive machines. A lot of places use them in rural areas if you're short-staffed, you don't have the resources to do CPR, because oftentimes it takes the person to do the compressions. You need about 2 or 3 because you can get super tired very easily. And then you also have another person intubating. I borrowed this one from the ambulance here in town. We have a few of them, so I was able to bring one for the presentation. So the bad thing about this is that it's a one-size-fits-all. So If you have your 250-pound football player that drinks 5 protein shakes for breakfast and eats 3,000 carbs a day, or 3,000 calories a day, he is not gonna fit under this as well as like a regular sized person. To put it on somebody, you put this board under their back, and then this part here, you lift up and it clicks in, and then this is around them. You then put their hands through here, strap them in, and it kind of like holds them in place. And then you can also put this cord so it goes around your neck, and then it'll clip into the side to prevent the device from going down and doing compressions on your stomach. It's also not very good if you have your 90-year-old grandma who weighs 80 pounds, because this is going to crush her. So I don't really like using this, but we use it when we don't have the resources available to perform CPR. So to start, you turn it on. This here is a suction cup. You push it down to the appropriate chest level, and it suctions to their chest, and then that helps push it down and pull up with the recoil. You then move to step 2, and it goes down onto their chest, and there's 2 settings. You can do 30 to 2, which is 30 compressions to 2 breaths. This is what you use typically if you don't have somebody there that can intubate, or you don't have a secured airway yet. Otherwise, there's the continuous setting that you use. You use that after you get the tube in their throat, so the intubation, and then you just continually bag every 10 to 15 seconds while this is continuing CPR. So this is down, ready to go. You push the start, and it does your compressions for you while you're traveling to the hospital, while you're trying to establish an IV. A lot of times, patients who are in cardiac arrest, your heart is stopped. Your blood is not flowing through your body. It's really hard to get an IV. We use this thing called an EZ-IO. That's where you drill into somebody's bone. You can either go on their shoulder or right below their knee, onto their tibia, and it sounds almost like a screwdriver. So you screw it in, you pull it out, you hook up your fluids, and then you're giving your medication through the bone that way. But I think I got everything. Yeah. Do you guys have any other questions for me? So. And then I also brought my stethoscope with if you guys want to play with it or pass it around or listen to each other. So we can do that.